Thanks for listening to the GOSH podcast. GOSH stands for the Gynecologic Oncology Sharing Hub, an open space for real and evidence-based discussions on gynecologic cancers. We'll share the stories of gynae cancer patients and survivors and hear from researchers and clinicians who are working behind the scenes to improve the lives of people with gynecologic cancers. Our podcast is produced and recorded on the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. It is produced by the Gynecologic Cancer Initiative, a province-wide initiative in British Columbia with the mission to accelerate transformative research and translational practice on the prevention, detection, treatment, and survivorship of gynecologic cancers.
I'm Marie-Lyne, and I am located here in beautiful British Columbia, and I will be your host for today. The first thing I'd like to do is to introduce you by reading your bios, if I may do that, if everybody is okay with that. We have Fiona Barvé, is a secondary school biology teacher who was diagnosed with ovarian cancer in 2017. In 2019, she was declared all clear, but she keeps a very close watch on her own health, going in for regular tests. Since 2019, Fiona joined the Public Patient Involvement Group, which allows patient involvement in research projects, helps raise awareness and raise funds for ovarian cancer research. She's currently involved in one of the two patient co-applicants on a large grant application for a clinical trial for PARP inhibitors, which Fiona has received since 2022 after her cancer reoccurrence. That's what my understanding is. Did I get that all correct, Fiona?
Yeah, except I am now retired, actually. I retired about a year ago, year and a half ago. But yes.
Dr. Marie-Lyne Alcaraz, did I say that correctly? Mm-hmm. She's the program manager for the ovarian cancer program at the Cancer Research UK Cambridge Centre, where she has played a key role in driving initiatives aimed at advancing ovarian cancer research and treatment. Thank you for that. Dr. Alcaraz obtained her PhD in organic chemistry at the University of Louis Pasteur. Prior to joining the team in Cambridge, she served as the lead chemist at AstraZeneca Charnwood. Is that correct? She has a passion for education and leadership, having previously been the head of science technicians at St. Mary's Catholic School and supervised a PhD student during her time at AstraZeneca. Is there anything that you would like to add to that or correct?
Nice. It's at school where I met Fiona, and we became best friends.
Oh, nice. Okay, so I'm going to just dive right into the questions that we have and let you take it away. I'm going to start with Fiona. I'd like you to tell me a little bit more, or tell our listeners a little bit more about yourself and your cancer journey, and what helped you the most with your mental health throughout?
Well, I think the bio said quite a lot, but I had a discomfort in 2017, in September 2017, and very rapidly was diagnosed that I had a cancer. I had surgery, I had chemo, I had Avastin. And then over here, we don't say clear, we say no evidence of disease at the moment. So I was given that in 2019 and joined the PPI group that Marie-Lyne had just literally set up. COVID hit. So we ended up having a lot of the PPI groups on Zoom for about a year-ish, I think, something like that. And we eventually got round to, under Marie-Lyne's sort of instruction or explanation, to meeting up. And we made a video of that, which has been publicised and circulated around Cambridge and the university. And that actually has led to some of the group joining us. So that was very positive. Moved on through the PPI, and because of Marie-Lyne and the way she leads, we have been looking at research projects, we've been looking at consent forms, we've been looking at how to simplify things to a point where people with a different language base can actually understand certain things like genetic testing. And all of that was going on. And then I had my CA125 rose 2 years ago. It only went from 6 to 11, but it was just enough to make me worried. I got a scan and found out that I had a recurrence. And since then, again, surgery, again, chemo. I've been asked to go on a trial, of which I'm only on the control side, the control arm. So I'm taking niraparib now. Still working away on the PPI with Marie-Lyne, doing different things, speaking at different symposiums. And I think the key thing for Cancer Research UK in Cambridge is the patient is the centre of everything. So as a result of that, the PPI, the ovarian PPI, has been quite vocal and I think renowned in Cambridge itself now, the actual Addenbrooke's itself.
Very lucky to have been involved in such an amazing opportunity. There's many, many out there, as you know, that have nothing.
I know. And I think the other side of it is I'm very lucky in England. It's a bit of a postcode lottery as to how you get treated and whether people are in the research hospital or whether they are out in a local hospital. So it's actually, yeah, unfortunately, it's not always the best scenario for a lot of people over here.
Yeah. Marie-Lyne, can you tell me a little bit about your role as a at the UK Cambridge Centre, how that all plays out?
Yeah, I think perhaps I should explain what is the CR UK Cambridge Centre. So the centre is one of 7 CR UK centres across the UK. And the Cambridge Centre is a partnership between the University of Cambridge, the Cambridge University Hospital, with a research hospital, Addenbrooke's, and CR UK. We bring together over 1,200 world-leading scientists. These include biologists, chemists, physicists, engineers, mathematicians, computer scientists, and leading clinical experts, including doctors, nurses, clinical trial coordinator, and allied healthcare professionals across Cambridge to tackle cancer from every angle. Our research is focused on detecting cancer at its early stage and developing personalized treatment for every patient. And the research is divided up into teams. Some tackle disease areas, such as breast cancer or pancreatic or ovarian cancer, whilst others address core disciplines like fundamental biology, cancer imaging, immunology. And you have about 17 research teams in total. And in addition, we are partnering, and the patient group is really involved in that, with the Cambridge University Hospital and the University of Cambridge on the Cambridge Cancer Research Hospital project to build a new kind of cancer hospital for the East of England region. This will change the story of cancer by bringing together world-leading clinical and research expertise under one roof to detect cancer earlier, to treat it more precisely, and save more lives. We are literally bringing the bench to the bedside. So even if we are called the Ovarian Cancer Program, we address all gynecological cancer. And the program is co-led with Professor James Brenton and Dr. Maria Crispin. And my main role is to ensure the delivery of the strategic objective of the program and adopt a proactive approach to cancer, train the next generation, and partner with the public. And it's, of course, this part that I'm leading our patient and public involvement. an engagement group that I started with Fiona, and slowly building the group. Now that we are 40, there were 40 patients in the group from all over the UK, and I start to introduce to international patients.
Wow, that's very exciting.
And you are more than welcome to join the group.
Might you spy me there? Yeah, it's, one of the things that I didn't tell you at the beginning of our conversation was that I was asked to come on board because they were hopeful that perhaps I could help spread a little bit of the word, because I have a fairly, not huge, but fairly large following on social media. So that's where I have been trying to put out the word, because one of the things that I'm finding is sort of what you are talking about over there, that people don't know much when they have received these terrible diagnoses that, just leaves them sort of just beside themselves. They don't know where to turn. So having opportunities like you are offering, I think is just amazing. And that's sort of why I'm here, to try and hopefully broaden the scope. Fiona, how has being part of this group affected you in your journey?
I think one of the key things, I think, especially when you're undergoing treatment, is you're with people who understand. And that actually is, you don't feel alone. You don't feel so isolated. I do have a big family. They're very lovely. And, I get on incredibly well with a full range of my cousins and aunts and et cetera. But I don't think people fully appreciate everything that you go through, just the fear of the scan, the fear of the results that, you actually have on a daily basis nearer the time. The other side of it, I'm actually, as you know, a science teacher, and I thought it would be really, really useful to keep my brain ticking over. So on the research side, it's just really interesting what comes through the PhD students as much as the professors. So that side of it keeps my intellect ticking over. Marie-Lyne was a big influence, obviously. I mean, I worked with Marie-Lyne for 5 years, I think, before I was diagnosed. And when she asked, that obviously was a call to come and do something positive as well. And I do think the group does some positive work and actually helps a lot of the clinicians and actually helps the researchers see it from a different angle. And just, I think it gives a lot of hope to a lot of women who, use our information and actually access us in various ways.
How would they access you?
So things like the genetic testing, it's a demo project that was set up between Cambridge and Birmingham hospitals. So there are, I think there's 3 or 4 different animated cartoon-like storyboards, which have multilingual, so you can pick the language. So one might be on what is genetic testing. Another one might be on why is it a good idea to have your genetic makeup being.
Yes. So one is what is genetic testing? One is what do my results mean? And the third one is what are the next steps? And they are translated over more than 10 languages as Bengali, Polish, Romanian, Urdu, Italian, and others. And this was done by the patient group from Cambridge and patient from Birmingham. It was a collaboration with the Birmingham Hospital.
What do you find, Marie-Lyne, are the biggest challenges that you undergo with the patient initiative?
The biggest challenge, in fact, are I think first it's rewarding. If I do this job, it's mainly because of the patient group, and even if it's only one part of my job, but this is the best part, is really working with such truly inspirational women and their partner and their family. And it's not only patient, the view of their partner, carer, family are really, and leading this group is really rewarding and impact, and it's an impactful experience. And I really look forward our weekly meeting. So we meet every week through Zoom. Every Tuesday at 5 p.m. we meet. And since COVID, it's a support group and a working group. So at the same time, because a lot of PPIE group are only working group, this group is a support group too. I think it's a big difference. And we provide them resource training, and we help them empower driving one of their most challenging period of their life. And some patients that benefited from research center, in fact, managed to have patients from local hospital having their treatment modified and improved. The challenge, I think the biggest challenge are the emotional toll. Witnessing the struggle, the loss, the pain that these patients are and their family experience is difficult. The other challenge is the financial constraint, the resource constraints. And many patient initiatives face challenge due to limited funding, staff, and resources. And balancing financial reality with the needs of the patient community often present a major hurdle. Gynecological cancer patients have diverse needs based on factors like cancer type, stage, socioeconomic background, mental health, and family support. And managing their expectation is hard. But maintaining the long-term patient and community engagement is challenging. And the worst is dealing with loss. It's very difficult to cope with, both personally, because I know each of the patients in the group on a personal level. So personally, but for the group as a whole, it's hard every time we lose someone. And this is why I thank all of them, all the contributors in our group, and other PPI group that often help us. But I think this is the hardest, and this year was hard because we lost 3 patients in 3 months, and so it was a difficult time for the patient group.
Okay. Fiona, the group offers lots and lots of patient resources. Is there anyone in particular that you found more useful than another, or what would you like to tell us?
Well, we tend to review resources rather than we've made one very recent resource, which actually is a poster, which we're using to highlight the use of the PPI. But most of our work in the past has been looking at things that have been made before, simplifying them. So I think there was 17 consent forms at one point. You went in to consent for your surgery, to consent for this, to consent for that. Can they hold your tissues, etc., etc. And they have, with our help, they've actually pulled it down to 2. So that has, as you probably know, when you're in a phase of disbelief that you're actually a cancer patient, to actually be given several different versions of basically the same thing, that actually is quite wearing. So that's the type of thing. But recently we've actually done a poster. It was actually for a symposium, but actually it's a really effective poster, and I think people are very jealous of our poster. Back of that, we've put that into a leaflet, and on the back of it we've actually put I think it was Marie-Lyne, your suggestion, wasn't it? The symptoms of ovarian cancer.
Yeah,
so
to raise awareness.
That can actually go out to GP surgeries, or it can be put on windows of shops, or it can be put on the back of toilets, toilet doors, because I think there's a lot of people who haven't got a clue what the symptoms of ovarian cancer actually are.
Well, I have to say I was one of those.
Well, so to be honest, so was I, and I actually had a cousin who died of it 10 years previously. But cancer 30 years ago wasn't talked about, so I give myself a little bit of leeway. It's only recently, in the past 10, 15 years, I think it's become more acceptable to talk about different things. So I'm going to use that as the reason I knew nothing. But, the whole concept of genetic testing, that's been brought to the fore through the PPI group. There's a various little aspects that have added into the research that actually goes ahead. So, can you really go for a scan every single day just to help out a research group when you're actually going through treatment? Have you got the finances to do that, etc., etc.? It's quite patient-led, some of the information that we give through.
Now you do a lot more because you manage to implement whole genome sequencing for ovarian cancer patients. It's because of this group. First was a pilot study in Cambridge, and now it's on the NHS nationally. And so now every patient diagnosed with ovarian cancer have their whole genome sequenced. You provide presentation, you do media, you do podcast, newspaper,
yes,
radio. You did the radio yesterday.
I did the radio yesterday.
And there was TV. You are co-applicant of grants. You are member of governing
My head is
board.
getting bigger, Mary.
Steering committee. I have a patient in our scientific advisory board. You present at conference. You went to Los Angeles at the OCAC meeting to present there. We had another patient that presented at another symposium. And I'm organizing an international symposium in March, and there will be all leaders from all over the world coming, and there will be patients presenting, and you are doing panel review. So I think you are not saying everything you are doing a lot.
Okay. But I think that this is very true. But when you talk about a resource, that I know what you're saying, and raising awareness is definitely one of them, and making it more obvious to people that we need patients to be part of the group, etc. But as resources, I'm not sure if that is your question, actually, Anita. Do you see what I mean? We do huge amounts, but physical things to hand out to patients, it's only part of the story.
Something I think that's very clear with what you're saying. There are definitely more than one kind of resource that is available, and part of it is the printed kind of resource that we're talking about. But I think more or less I was talking a little bit more about support and actually becoming a member of a group or helping other people with this. Do you find that helpful? I know myself that I'm not in a position to do anything such as you are, other than this kind of podcast, which I'm working on. But for me, the resources that help me are me being able to do things. I love to be able to get out, and like when I go for my chemo, which I'm having every 2 weeks now, one of the things that I want to do, and I have said this before, I see these women that are, well, and men too, because it's a unisex where we go. Obviously, don't have ovarian cancer at that stage, but they have cancer of sorts. I just want to reach out to them when I can tell that they're newbies. And be that resource for them. I am not in a medical field. I can't help you, nor would I even want to. But can I help you have some hope? Because my gosh, there's way more hope than the moment that when you were told that you had cancer. Like everybody almost reads that as a death sentence. And it's true, that may happen to some or all of us, I don't know. But there's an awful lot of hope out there. It's come a long, long way, and especially because of people like you and Marie-Lyne. That's what's helped us and brought this all through with the research.
I think there's one member of the group who told me actually that part of the reason that she had any hope was because that people were on the Zoom and they were still alive.
Yes.
You know,
Yes.
on the PPI group, and people were still there, and they'd been there for, and in my case, 7 years. So, you know, it made her more hopeful, especially when you see the statistics. Sometimes the statistics can really bring you down. I fortunately have got a statistician as a friend, and she basically said, well, you know, you've got to get the right bit of data and the right age group and the people in stage 3 who did this, that, and the other, and stage 4 who did this, that, and the other, and then look at your percentages.
Yes, exactly. I'm really glad you brought that up, because that's something that personally has bothered me over my journey, that I have been lumped in with statistics that really are not true statistics, just because, as you said, were those people in my age group? Did they have any pre-existing diseases? What was their lifestyle like? What kind of health did they have? There's just so many different variables before you can really tell what your statistic is like. So I think they should, in some regards, just toss those to the wind. That does give us more hope, but it is amazing when you see somebody, oh, she's had stage 3 ovarian cancer for 7 years. Well, maybe I can do that. And that does give you way more hope than the 4 to 6 months that you might have been given in the first place.
Yeah, no, I agree. Yeah, I'm stage 4. All right, don't make it any worse. My goodness.
It's amazing. But look at you.
I know. There is something about the personalized medicine. There's something about genetic testing. There's something about having the right surgeons, having the right oncologists, having the research group behind you. I think I have been incredibly lucky where I live. I can't stress that enough in the UK. And I've been incredibly lucky with the team of, we're talking 100, 200 people who are just dealing with ovarian cancer, and the research behind it. And it's quite empowering, really, just to have that as a resource that's, behind us. And on top of that, obviously, the PPI group, I think if there hadn't been one, I think that would have been an awful void in my life, actually, especially when you're going through treatment, and you just need somebody to say it's okay, it's right, it's life, get on with it.
You only have one.
Yeah, do. You might as well enjoy it as much as you possibly can.
Could I just ask, I guess we should be finishing up here, because I have to make sure I don't take too much of your time, but Marie-Lyne, is there anything that you would like to tell us before we close down? Any particular things? And I'll ask the same question of you after, Fiona.
No, I think I really want to thank every patient who joined the group. I would say that it's a lot of people want to join the patient group, but you need to select the right people. And because you need to have people who really want to engage and change and be part of it, and stay positive, and they will influence, obviously, the future of the next generation of people being sick, probably not themselves. So I know it's hard, but it's hard to find the right, and I am so lucky to have the right number of people in this group, and they are so much involved and so motivated to do everything, and all of them with different background, different age, and different stage of cancer, or different even cancer, that they are really doing everything, and so responsive and really united, and I cannot thank them enough. And I welcome more members, because unfortunately, being diagnosed with ovarian cancer, unfortunately, we are losing patients. So we need always more patients to join. And I'm looking forward to having more people from wherever and to join and want to do a difference.
How would they go about reaching out to join?
You can contact me. I can put my email address. It's Marie-Lyne Alcaraz@cruk.com.ac.uk. So I think, yeah. So Marie-Lyne, yeah, it's not an easy one.
Yeah, well, maybe we can get that on the podcast. We'll have that written out. That's amazing. Thank you very much for everything that you are doing. We do appreciate, especially somebody like myself, for sure. And Fiona?
For me personally, I think you should stay positive. I think it affects the way you approach life, and I think it gets you off the sofa, and I think it affects everybody around you. If you're positive, they stay positive, and that actually is a happier life. So that's my detail.
I'm in total agreement with you. I'm thrilled to have met both of you today, and we'll keep in touch. And I'd like to thank you for this. So, any last words, or are we all good?
No, thank you for having us. Yeah, thank you for the opportunity, and thank you for it's so nice to meet you.
Thanks, ladies. Bye-bye.
Thank you.
Bye. Thank you. Bye.
Bye.
Thanks for joining us on the GOSH podcast. To learn more about the Gynecologic Cancer Initiative and our podcast, make sure to check out our website at gynecancerinitiative.ca.